In this scenario, we have our nurse, Tabitha, coming in to take Brianna's vital signs using the ADET method, which means acknowledge, introduction, duration, explanation, and thank you.
Come in.
Hey, Miss Bates, how are you doing today?
I'm great. How are you?
I'm great. I'm Tabitha Mizell, and I'm a student nurse from Mississippi College School of Nursing.
Okay.
And I want to take your vitals today, okay? So since you said you had a sore throat, I'm going to take your temperature auxiliary, okay? So lift up your arm, please.
And how long is the vital signs going to last?
About 5 to 10 minutes.
Okay.
Beep.
Okay, I have your temperature. And now I'm going to take your pulse.
Okay.
So just relax.
Tabitha is taking Brianna's radial pulse, and what she'll do is count for 30 seconds and multiply that number by 2. For the following 30 seconds, she will sneakily take Brianna's respirations without her knowing.
Okay, Miss Bates, your pulse is 68, and your respirations are 16, okay?
Is that good?
That is good.
Okay.
Mhm.
I'm normal?
Yes, pretty much. And now I'm going to take your blood pressure. So if you will, put your shirt up, your shirt sleeve. Have you had a pretty good day?
I have.
Great.
Just great.
Okay, your blood pressure is 112 over 62.
Oh, okay.
Thank you for your time, and the doctor will be in shortly, okay?
Okay.
Have a good day.
You too.
During this video, Nurse Quayla is talking with her nervous patient about her blood pressure medications. She is demonstrating the exploring technique by using therapeutic communication, and she is also using the solar technique. S is for sit squarely, O is for open posture, L is for lean forward a bit, and E, eye contact, and last is R, relax.
Nurse, I'm still really concerned about my blood pressure. It just won't seem to go down.
Okay, could you tell me about what medication are you on?
I'm on Captopril.
Okay, and with Captopril, you have to understand that it doesn't take effect immediately. How long have you been on it?
About 3 days.
Okay, it usually takes about 5 to 7 days, so I'm gonna have you to come back in Wednesday. We're gonna check your blood pressure. We're gonna see how it took effect yet.
Okay,
Okay, thank you.
thank you.
During this video, Nurse Brianna is talking to her patient Tabitha, who is nervous and thinks she has a weird, obscure disease. Brianna will be demonstrating the therapeutic communication technique of being honest and also using the solar technique, which stands for S, sit squarely, O, open posture, L, lean forward, E, eye contact, and R, relax.
Hi, Tabitha. Tell me, what brings you in today?
Nurse, I have itching all over. I've had these horrible headaches in like my dreams. I have like the most vivid dreams, and that's never happened before. I can't sleep, and I'm just itching, and I'm hot. I don't know what it is.
Okay, does it run in your family, like bad dreams, or?
Not that I'm familiar with,
Yeah.
no.
Has it recently started happening, or?
Well, about an hour ago it started,
Okay, and have you told anyone about this?
Well, my friend, she said there's this new like sickness going around. It's like streptococcus or something. I don't know. Do you know what that is?
Yeah, well, I will go find out for you.
Okay,
And
so you don't know what it is?
I'll go find out for you really quick.
Okay, thank you so much.
You're welcome. Just 1 minute.
Okay. I'll be waiting on you. Just hold on.
Okay, hi Tabitha.
Hey.
I found out, this is just a little pamphlet of
Okay.
some people, some like counselors you can go see and stuff.
Okay.
And maybe they could help you with your bad dreams, and then we will give you some medicine for the itching. Maybe it might be
Okay.
allergic reaction.
That
or
sounds
something.
wonderful.
But I don't think it's tripicolata. So here you go.
Thank you so much.
You're welcome. Nurse Lauren is coming in to talk to a worried patient going into surgery, and she will be using the false reassurance non-therapeutic communication technique.
Good morning, Miss Nash. How are you this morning?
I'm not good at all.
I've heard you have some concerns. What's going on?
I'm just really scared with surgery. I'm scared of the anesthesia. I'm not going to wake up. The procedure not going to go right. You guys leave an instrument in my body. I'm just scared.
Don't worry about it. We do the surgery almost routinely. It goes well every time.
Are you sure?
Yes, I'm positive you will be just fine.
I don't think so.
I promise you will be fine. Our doctors are amazing.
I'm going to hold you to it.
Yes, ma'am.
Okay, here are some basic principles to the nurse-patient communication process. Always remember with visually impaired patients, you have to touch them, use a caring voice, and always make sure to orient the patient to the room so they can know where they are.
And for the hearing impaired patients, you want to make sure you talk slowly so they can read your lips and understand what you're saying. Always use happy facial expressions, because if they can't hear you, then they don't know if you're upset or if you're happy or anything. And always make sure you're facing the patient so that way they can see you and be able to read your lips better and see your facial expressions.
Okay, here are two more basic principles related to the nurse-patient communication process. When you have an unconscious patient, make sure you're careful about what you're saying because they may still be able to hear you. And then talk to them like they're a conscious patient. Tell them what you're doing, whatever you're doing, the procedures and such, and then touch them. Let them know that you're there and that you care about them.
If you're communicating with a patient in which there is a language barrier, you can always get a translator if that is all possible. Repeat what you say, and maybe eventually they'll